Of animals were these?
I think initially they considered a study in piglets because the study that Dr. Schaefer quoted, the rectal study, which I don't believe is totally...
What kind of animals were these?
Initially they were proposed to do piglets, and then the decision was made to use beagles since they could more easily accept an oral gastric tube so that we could be sure that the drug was actually in the stomach and not influenced by the mucosa of the oral pharynx or the mucosa of the esophagus. So the tube was put in their stomach. It doesn't hurt the animals, and doses of propofol were then administered.
Ian Glenn is commonly referred to as the father of propofol, correct?
Ian is the inventor. He's a laboratory scientist. He's a good friend, and he played a major role in the development of propofol from a laboratory molecule to where it began clinical use. So I guess the definition of father, some people have called me the father of propofol.
Some people call Ian Glenn the father of propofol, correct?
That's true, I guess.
And he's someone you look up to?
Ian, I consider a friend, yes.
Okay. And he told you that propofol had no oral bioavailability, in his opinion, based on research he had done many years ago, correct?
He didn't really say he had researched it. He said it was his understanding that studies had been done in rats or some rodent model, and it didn't appear to have an effect except after a massive dose had been administered. That's more or less, I'd have to look at the emails to be sure.
Okay, so you had indicated earlier that at some point you had called Ian Glenn and he had shared that information with you, right?
It was actually an electronic communication which I shared with Dr. Schaefer.
Okay. Ian Glenn shared information with you regarding his belief, his opinions regarding oral propofol and it not being bioavailable, right?
That was correct.
And sometime when? I'm sorry?
I'm sorry. Certainly a month or two, probably 2 months after I received the report by Dr. Schaefer.
Now, this study on the beagles in Indiana that Mr. Flanagan commissioned, did you ever review any data or were you provided any reports in regard to that study?
No formal report, only an oral report that it had no effect, which confirmed what my suspicion was, and it confirmed what Dr. Schaefer proposed.
And who provided you this oral report?
Mr. Flanagan.
As a scientist, you weren't interested in getting the data or speaking to the people that did the research?
It was a negative study that confirmed what Dr. Glenn had suggested and what Dr. Schaefer had suggested. And, I was aware of the extensive first-pass metabolism when propofol is absorbed and passes through the liver, so I didn't see a negative study. I didn't see a need to pursue it. And to be honest, I was quite shocked to hear that Dr. Schaefer had taken the oral medication and commissioned a study in human beings.
You were aware of first-pass metabolism when you wrote your March 8th report saying oral propofol was a possibility?
I was aware it's absorbed and goes through the liver, yes. But it doesn't mean it can't potentially have an effect.
Well, you attributed it as a possible cause of death. And you did that when you were aware of the basic principle of first-pass metabolism?
Sir, a study had never been conducted in animals, a published study in animals or in humans with oral propofol until Dr. Schaefer performed a study. And I have to assume that my colleagues, Dr. Sepulveda and Dr. Schaefer, would not commission a study if they didn't feel it had some value.
Actually, Ian Glenn's study was oral, right?
Ian Glenn's study was not published in a peer-reviewed journal, and I'm not aware.
You said there were no studies involving oral propofol. Ian Glenn's study, which I think was possibly in the 80s, that dealt with oral propofol, correct?
Your Honor, that's an improper question. It assumes facts, not evidence.
It's a question asking about a study. I'm going to sustain the objection to the form of the question.
You were aware of Ian Glenn's paper that discussed oral propofol and it not being bioavailable based on his animal study, correct?
Incorrect. I think I stated earlier I was unaware of any studies in either animals or in human beings.
But you were aware of the first-pass metabolism and still felt that oral propofol was a viable theory in this case in March 2011.
A lot of drugs have first-pass metabolism that still have a clinical effect after oral administration, so that does not rule out the possibility.
And so what ruled it out, though, was just Mr. Flanagan calling you and saying, I know someone in Indiana that did this study, and he told me the findings were it's not bioavailable, and you were satisfied then, based on that conversation?
That's not what I've stated. To restate it again, what I said was I got Schaefer's report, which suggested that this was unlikely.
Actually, he said it was not possible.
Okay, not possible. But if he thought it was not possible, he then did a study. But I then communicated electronically with Dr. Glenn, who also confirmed that it was his understanding that that animal studies done by Imperial Chemical Industries in the 70s, I believe, suggested it wouldn't be effective. And based on those two remarks and Mr. Flanagan confirming that the study he commissioned with propofol administered through an oral gastric tube, it seemed fairly convincing to me. I didn't see a need to pursue it further.
And so just to be clear, then you never requested any data or any findings. Mr. Flanagan told you it was negative and you were satisfied, correct?
Yes.
Was this a way to essentially save face so you didn't have to say that it was Dr. Schaefer's report that caused you to change your mind?
That's argumentative.
Sustained.
How long did the study last involving the beagles?
As I stated earlier, I was not involved in the study. I think it was done sometime during the summer, and I don't know when it was concluded. It began or concluded.
Now, in the scenario that you've put forth, just to be clear then, when Michael Jackson, in your mind, self-ingested the 25 milligrams or self-administered the 25 milligrams, was in your scenario, that's not the time period when Conrad Murray left the room for 2 minutes? Is that your testimony?
My testimony is I cannot be sure of the time frame because I understand from phone records that I have reviewed that after observing Mr. Jackson for a period of 20 to 30 minutes, Dr. Murray had gotten some phone calls and he began returning phone calls in an
My question is it your opinion that when Michael Jackson self-administered the 25 milligrams of propofol, is that taking place in your mind when Conrad Murray leaves for 2 minutes, or is it at a different point in time that Conrad Murray left Michael Jackson alone?
It could well be at a different time. I don't know that the time is established.
And in your scenarios, based on the evidence in this case, when you put forth that Michael Jackson may have consumed 8 2-milligram lorazepam tablets at 7 a.m., does that also assume that Conrad Murray has left Michael Jackson alone?
Not necessarily, because I understand that Mr. Jackson walked around. He apparently had another
Objection, motion to strike. Okay.
The objection is sustained. The answer stricken. Disregard it. Refine your question, please.
Is your analysis and the theory you put forth, does it assume Conrad Murray was out of the room when Michael Jackson, according to you, consumed 8 2-milligram lorazepam tablets?
He could have been in some place, presumably, away from Mr.
Does your
Jackson.
analysis assume...
I think the witness is responding to the question. You can follow it up. You can finish your answer, Dr. White.
I assume that Dr. Murray was in some other part of the room. I think there was an anteroom and a bathroom adjacent to the bedroom. Actually, my understanding is there was 2 bedrooms connected. And since he apparently moved between the bedrooms, I think it's likely Dr. Murray was somewhere in the vicinity, but certainly Mr. Jackson had the capability of going into either room and
Does your analysis assume that Conrad Murray was unaware that Michael Jackson swallowed 8 2-milligram tablets?
Yes.
So he was either in a different room or not watching. Is that fair to say?
Fair to say.
And then you know from Conrad Murray's statement, the only time he tells the police in his statement that's been introduced into evidence, the only time he tells the police that he left the room was 2 minutes to use the restroom. And when he came back, he found Michael Jackson not breathing, correct?
But we also know he was
Is
on...
that correct?
I believe that was the statement in the police interview, yes.
Okay. So we have the time when he's either gone or not paying attention at 7 a.m., correct? Based on your scenario.
Excuse me.
Based on your scenario.
On or around that time.
Okay.
there
Then
were
we
also-
have the 2 minutes that he tells the police he was gone, and that he comes back after 2 minutes and finds Michael not breathing but with a pulse, correct? We have that time frame.
I think the 2 minutes refers to when he was in the restroom.
Okay. And then we also have, you're saying, under your analysis, it's a different time, based on your analysis, when Michael Jackson self-administers the 25 milligrams of propofol, correct?
I'm not sure, sir. All I said was that I've reviewed the phone records where Mr. Murray was on his cell phone, presumably away from Mr. Jackson because Mr. Jackson was trying to sleep.
And that's just a common sense assumption, right? That if his whole job is to put Michael Jackson to sleep, when he's on the phone for a lengthy period of time, he's probably not standing there in Michael Jackson's presence, correct?
That's what I would assume, yes.
So at whatever point this happened, then you're assuming in your scenario where Michael Jackson self-administers 25 milligrams, you're assuming that he's in bed and at some point Conrad Murray leaves him, right?
Correct.
And as you demonstrated on Friday, that Michael Jackson then gets a hold of a syringe and draws up 2.5 milligrams of lidocaine, correct?
I don't believe that's what I said, sir.
What did he do in regard to lidocaine based on your computer model that Dr. Anellis created?
My understanding is that Dr. Murray drew up 50 milligrams of propofol and 50 milligrams of lidocaine into a 10 cc or 10 milliliter syringe. And he had...
So your scenario is assuming that Conrad Murray drew up a syringe and left it there? Is that what you're assuming in your scenario, yes or no?
Can I finish my...
No, what you're relaying is something the court's already ruled on. What I'm asking you is, are you assuming that Michael Jackson drew up the syringe or Conrad Murray? Which one?
I'm assuming that it's the extra 25 milligrams that Dr. Murray had drawn up that was
So
self-administered.
Conrad Murray drew up the syringe in your analysis? Yes or no?
Yes.
And he left this syringe then in the bedroom when he left the bedroom?
First of all, I don't know that he left the bedroom. I'm told that he was standing in kind of a hallway.
Objection. Non-responsive based on the prior
The
court's
objection
ruling.
sustained. The answer stricken. You can answer the specific question if you're able to. You will rephrase the question, Mr. Walgren.
I'm asking about the computer simulation you presented to this jury. In that analysis, is there an assumption made that Conrad Murray drew up a syringe and left it in the bedroom? Yes or no?
There is no assumption about who drew up the drug in the computer simulation.
In your statement that this was the most reasonable interpretation, are you assuming that Conrad Murray drew up the drug in the syringe or Michael Jackson?
I thought I stated earlier that I felt it was Conrad Murray.
Okay, thank you. And that Conrad Murray then leaves the room, leaves the patient in the bed with a syringe accessible to the patient, correct? That's one of your assumptions?
I did not say where the syringe was left. I said Conrad Murray left the patient after observing him for 25 to 30 minutes to make some phone calls. And
There's nothing in the police statement where he references making phone calls. Dr. White, you've been told repeatedly that your opinion is to be based on the evidence in this case. Do you understand that?
Your Honor,